There's so much to remember. School is so hard. How do people
What
make
did
it
that
through
professor
this?
say?
I want to be a nurse. I want to be a good glomerular filtration rate, pediatrics, geriatrics,
But what's going to be
heart
on the
rate,
test?
high
Stroke
Fowlers,
volume?
low Fowlers. Some say that nursing school is the hardest thing that they've ever done. I'm Dr. Hobbick, and I am a passionate nurse and a passionate nurse educator, and I'm here to help. Join me on Nursing with Dr. Hobbick as I review topics and highlights from nursing school and try to help nursing students become confident nurses and provide the safest, best quality patient care that's possible. Hey, welcome to Nursing with Dr. Hobbick. So today we're going to talk about aging and older adults. So as nurses, we're going to encounter a lot of older adults. The first thing we need to think about are all of the myths and stereotypes that are available out there. So we, at least the culture I grew up in, we think of older adults as ill or unattractive. You think about the stereotypical witch. She's got a big nose with a wart and hairy chin, and she's really ugly. So that's not really true. We need to think about the fact that we don't intrinsically change as we age. So the people who are older are still interested in the same things. So we want to make sure that we aren't taking part into those myths or stereotypes. There's a lot of health issues that affect older adults. Hydration is a big one, impaired nutrition. Obviously, we may see some decrease in mobility. They experience a lot of losses, and not just deaths. Obviously, the older they get, the more likely they are to have a death in their family, death of a spouse, death of even children. But they also lose things like their livelihood. They lose income. They lose the part of their ego that was their profession. Like, I'm a nurse, and so when I retire, am I still a nurse? That is something to think about. We need to make sure that we are thinking about Erikson when we're thinking about nursing. So for our older adults, it's integrity versus despair. So a lot of times older adults are going to reminisce, and it's totally fine to allow them to reminisce. Something that we need to assess for older adults is functional status. So when we see changes in their performance of their activities of daily living, we need to think about what disease process or worsening condition is causing that. Knowing about the different cognitive disorders we can see, while they are not common or normal expected signs of aging, we do see people who have delirium, dementia, and depression. These can look like each other. Delirium is either hypoactive, hyperactive, or mixed, and you can imagine what that looks like. Delirium is an acute confusional state. Dementia is a generalized impairment or progressive disease. And then depression is obviously a mood disturbance. Someone dealing with all of these losses that our older adults go through can certainly experience depression, and a hypoactive delirium can look like depression. So that's some screening that we really need to do. We need to also consider that older adults are disproportionately affected by poor health literacy in this country. So we can not ever assume that our patients know exactly what we're talking about. We really need to make sure that they understand what their medications are, what the treatments are, what their condition is, what they can do to make their life better, and how to take their medications the correct way. I hope you enjoyed talking about older adults, and we'll see you next time on Nursing with Dr. Hobbick. Hey, this is Dr. Hobbick. First, I want to say thank you for listening. This podcast is intended for nursing students to help them understand concepts that they're learning in nursing school, and maybe for students who just graduated and want to refresh on concepts, or nurses who just want to listen. Anyway, I do want to thank you for listening, but I also want to say that by listening to this podcast, you agree not to use this podcast as medical advice to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. I want to encourage you to consult with your own physician for any issues you may be having. They will be your best source of information that is accurate and consistent and based on research and evidence. Again, thanks for listening, and I'll see you next time on Nursing with Dr. Hobbick.